Alright guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have a special guest, Page Mayo, who's a physical therapist of many years. I won't say how many years because that'd betray your age, and you look so young.
It would give away my age, but
give me a hint. How many years you've been practicing?
30 years. That's more than a
hard
hint.
to believe. You must be in my anti-aging program.
Yes, and I started when I was 5 years old.
Well, you look great. You know, I've known you for a long time, and we've talked about this podcast forever. Mm-hmm. So thank you for coming today. We're going to learn a lot today. You brought a model.
Yes.
Page Mayo is an athlete. She's a longtime physical therapist, and her specialty is really pelvic floor dysfunction. Mm-hmm. I sent a lot of patients to you, and you help every one of them. And what's your motto? I think I've got it written down here. No leak is ever normal.
That is correct. No leak, whether we're talking a drop, a dribble, a gush, is ever normal in life, no matter your age.
I love that. Introduce yourself a little bit as to how you got into this and your passions, and now you see patients on your own. You have your own company.
Yes, Active Life Physical Therapy.
I love that. Active Life Physical Therapy.
Yes.
Okay. Physical therapists are some of my best friends. Ernie.
Yes.
And,
we're a great group
Greg,
of people, for sure.
Janet, Chris.
Mm-hmm.
I know so many physical therapists that really help people out tremendously. People don't realize how much great physical therapists do. People become too reliant on medicines, and they don't really realize how physical therapists can help you get to the root cause of your problem, which in my practice is what I try to do with anything. But tell the audience a little bit about yourself first.
Okay, well, my name is Page Mayo. I'm a physical therapist. I've been a physical therapist for 30 years. Initially started in the hospital, acute care setting, but I've done all settings. Got involved with pelvic health because I wanted to solve my own problems. Decades ago, years ago, even the most recent past, pelvic health has been under discussed. It's been somewhat of a taboo subject. This is where I'll date myself as well. Remember the show I Love Lucy?
Sure do.
Yes. So we had Lucille Ball, Desi Arnaz.
Yeah.
They were a married couple.
Little Ricky.
Yes, they were a married couple, but in the show they slept in separate beds, right?
Oh, sure.
And when Lucille Ball actually became pregnant in real life, they wrote it into the program, but they wouldn't say pregnancy because it was a taboo subject that was under discussed. They did not want that out in society, if you will. Sure. Now, our current generation, our Generation Z, our millennials, they are definitely pushing for more pelvic health services, particularly with pregnancy and postpartum. Just with one pregnancy alone, you're at 50% risk for a prolapse, and we'll talk about that later. But any pregnancy can lead to issues with what we call stress incontinence, which is the leakage when you cough, laugh, or sneeze.
Very interesting. So you got into this based on your own personal interest in this, and you're right. I mean, I had a lady last week in my practice that was sitting down, she sneezed, and her uterus prolapsed, and she had to have surgery that week on it.
Yes.
Painful.
Yes.
So this is interesting. So you're saying with one pregnancy, you have a 50% of those women develop some kind of
prolapse.
Prolapse
yes,
in
they
itself.
Can have a prolapse in and of itself, as well as pelvic floor dysfunction. Now, with the prolapse, generally it's a grade 1 or 2. There can be grades up to 4. But with just a pregnancy, forget birth, just the pregnancy, the weight of the pregnancy on the pelvic floor.
That is really interesting. I'm glad you brought a model.
Yes,
what do you call her?
Tom, this is Polly. This is Polly pelvis. So this is a model of a pelvis. Now, a pelvis is made up of a group of different bones that work together. Everything in your body circles back in some way to your pelvis. From the top of your head, you've got your vertebral column, 33 bones that come down to your sacrum, which is directly, if I turn Polly around, this is the back side of Polly. So this is her sacrum. So we've got her head and then 33 bones that come down. And then if I turn Polly back around from your big toe to your ankle, to your knee, to your hip, inserts an acetabulum here. This would be your right hip. This would be your left hip. Now, if I turn Polly as if she's laying down. Now,
Okay.
Polly has her head here, okay, and her legs here. All the red stripy things that you see, that is the pelvic floor. It's a group of 14 different muscles that have 3 specific functions. If you look at our model, Miss Polly, the pelvic floor looks like a hammock. We have a point of attachment at the pubic symphysis, and that's the bone there, wraps around, and then on the back side of Polly, we see the pelvic floor at the sacrum as well as the coccyx. So, looks like a hammock. It supports your pelvic organs. Now, what are your pelvic organs? They're your bladder, your rectum, if you're a female, your uterus. So it helps to keep things where it should be in space. That's the first function. Second function is sphincteric. Now, what we mean by that is the pelvic floor helps to open and close our openings. Now, I make things,
Sphincters, okay.
Yes, I make things super simple.
Good.
This is your front door if you're a woman, okay? So this is your front door. This is your vagina. This is your urethra. This is your clitoris. This is your back door. This is your anus. This is where we defecate. And of course, your urethra is where we urinate, we void, or just plain language, that's where we pee, okay? So the pelvic floor is responsible for opening and closing those openings, hopefully when we want them to, and not when we don't want them to.
Right.
And then the third function, of course, is sexual. So with pelvic health, some of the issues that we might see if you have pelvic floor dysfunction, issues at the front door might include that pelvic organ prolapse, okay? We might have urinary issues, whether we're talking about incontinence, retention. We could have a mixed, whether it's stress incontinence, urge incontinence. And then third, we could have pain with sexual intercourse. Issues we might see at the back door include chronic constipation, uncontrolled gas, or wind, as we call it, and as well as diarrhea. Now, usually constipation and diarrhea go back and forth because your body's last defense at constipation is diarrhea. So that's
IBS.
poly, yes.
That is poly. I've never seen a pelvic model that good at demonstrating that pelvic floor. So I guess when the surgeons go in there to repair a prolapse, they're talking about the sling, which is like a hammock, right?
Yes.
Holds everything together. So when they repair this, they're repairing that hammock or sling.
They're actually lifting the bladder where it should be in space. Typically with surgical intervention, which as a pelvic health physical therapist, we try to avoid that. That's a last ditch effort. There are circumstances where it's unavoidable, can't get my words out. And that would be a grade 4 prolapse. Prolapses are reversible. You can, with therapeutic exercises as well as modalities, help to reverse that and avoid surgery. With surgery, evidence-based research shows that there's a 30% chance that it will not solve the problem.
Interesting. 30%. So you see mostly women, right?
Yes.
But a man has a pelvis like this as well. with the same muscles. Am I right?
Yes, the same 14 muscles.
But they don't have babies. And
No, they don't have a uterus, and they don't, yes.
So it's a lot more common in women. So you see
Absolutely.
mostly women. It seems like to me that you have these muscles, and as you get older and you have incidences like childbirth, pregnancy, etc., maybe stomach problems, too much weight in that area,
Yes.
that you should strengthen up these muscles. Is that a lot of what you do, is muscle strengthening?
Yes.
That otherwise you would never work on because it's so specific, like Kegels? Is that is it?
We're, as a pelvic health physical therapist, we're beyond Kegels. Beyond Kegels, absolutely.
Okay. Maybe you should write a book, Beyond Kegels.
Absolutely. The pelvic floor is no different than any other muscle group in your body. If we don't exercise it, it gets weak. There are other pieces of the puzzle which can increase the weakness of the pelvic floor. Once again, just a pregnancy. Not just the childbirth, the pregnancy alone. Okay? The number or the parity of pregnancies that you have also increases your risk for the dysfunction, the weakness, the prolapse.
And pain, maybe?
And pain as well, absolutely. Being overweight is another piece of the puzzle. If you've had any abdominal surgery, okay, that includes gallbladder. If you've had a hysterectomy, when we take something out of the body, gravity's never our friend, especially as we age, right?
Especially you hear hysterectomies.
Yes.
Almost all those women have the problem.
Absolutely, because what happens is the bladder and the rectum try to take up the space of where the uterus was. So that increases the risk for a prolapse as well.
So everything's kind of lax where it used to be tight.
Yes.
So when you say you need to exercise those muscles and it's beyond Kegels, tell me a little bit about how you exercise these muscles.
Absolutely. So the pelvic floor also relies on your deepest inner core. The muscles in particular are the transverse abdominis. That's on the front side of your core.
Okay.
Then on the back side, your back extensors are the muscles that cause you to extend, but particularly the multifidus, that group of muscles.
And that's one that you don't see very often unless you look at
No.
an MRI. But I've heard for your spine, the multifidus is probably the most important thing in preventing back problems that we see all the time.
Yes, and going back to everything circles back to the pelvis. If you have dysfunction in some other area of your body and you compensate within your pelvis, then that also can be a piece of your puzzle as well. So
everything works together.
100%.
So you need a strong core, which means abs and back for your pelvis.
Absolutely. And then we also need to add in the diaphragm. The diaphragm is your breathing muscle, okay? It works with the pelvic floor. When we take a good deep breath in our tummies, okay, that's diaphragmatic
Belly breathing, okay.
Yes. When we take a good deep breath in, our pelvic floor descends, it goes down, it elongates. When we exhale, they work hand in hand, and the pelvic floor raises, it contracts, it supports getting the air out of your lungs.
So are you saying that by doing breathing exercises, which I talk about all the time,
Yes.
I do them for my back, actually is one of those exercises you do for your pelvis?
It is the foundation.
It's
the first thing that I teach patients, because if you don't have that automatic coordination, and it's automatic, it's just the way we're made. If you don't have that automatic coordination, you're not going to be able to effectively and efficiently strengthen the pelvic floor.
That makes a lot of sense to me. A light bulb just turned on. You turned on a light bulb in my head about this because, you know, I've read the book Breathe by Nelson. I've talked to Zach Kramer, who's a breathing expert on this podcast, but I don't think I've really correlated it that much to the pelvic muscles. I know for a fact that deep breathing is great for your back. You know, and actually when you try to stretch, if you start deep breathing, you can stretch way farther than you can if you don't breathe. And I'm convinced that hardly anybody knows how to breathe right.
Yes, totally agree. And I see that quite frequently in my patients.
They breathe too shallow? Is that what you're saying?
Yes, well, they're chest breathers. So here's something we can do right now. Put one hand on your chest, okay? One hand on your tummy. Now, with diaphragmatic breathing, we're going to breathe into our tummy. We're going to breathe in for a count of 4, and then we're going to exhale for a count of 6. There should not be very much movement at your chest. It should be in your tummy. That helps to engage the pelvic floor. So let's do it together. You ready?
Are we breathing in through the nose, out through the mouth?
You can do it either way, quite honestly. Now, I prefer pursed lip breathing. I do. And that's where you breathe in your nose, pucker your lips, and blow out. Okay? So, let's monitor our chest and our tummy. Let's take a good deep breath in. Good. And then exhale. One more time for a count of 4. Deep breath in. 4, 3, 2, 1. Exhale. 6, 5, 4, 3, 2, 1. Congratulations. You have completed step 1.
All right. Now, actually, how should you do this? I mean, should you set aside a time during the day to do this, or just how often should you do that?
I go back to the pelvic floor is no different than any other group of muscles in your body. Super important as we age. Beginning our 3rd decade of life, we start to lose muscle mass. On average, every decade, beginning our 3rd decade, it's 3%. 3%. So even more the importance of exercise as we age.
So these deep breathing exercises, which I need to do for a lot of reasons, especially I forget the belly breathing. You know, it's definitely more efficient.
And
so,
it engages your pelvic floor.
That's right, which is something I never thought about. So how many times a day, when you meditate or you take 10 minutes in the morning, 10 minutes in the evening, is that enough?
That's fantastic. The more the better, because another side effect of diaphragmatic or deep breathing is it engages the parasympathetic nervous system, which, yes, I mean, that's another topic, but it engages the parasympathetic nervous system, which is your calming nervous system.
Sure. Talk about that all the time. You know, as a matter of fact, when I talk about breathing, it's really for anxiety. I really think you can breathe off a panic attack. Breathing is just, it's underrated, isn't it?
It is, 100%.
So these deep breathing exercises, what about, besides losing weight, how about core exercises like planks? Does that help your pelvic muscles?
Yes, but we start with something even that's simpler than a plank, because most people, unless they routinely exercise, may not be able to do a plank. We specifically target the deepest abdominal muscle. It's called the transverse abdominis. It's that wonderful muscle that we see the lines here and then down into the sides. So abdominal muscle bracing is an exercise that anyone, any age can do.
Is that an isometric exercise where you just kind of tighten up your
Yes,
muscles?
Somewhat so. There's 2 different variations. There's one that I do that you're lying on your back. You engage your pelvic floor. You take a good deep breath in. You exhale. As you exhale, you bring your tummy, your belly button, to your spine. You hold that contraction for 10 seconds, but you count out loud because I don't want you to hold your breath. And then you let it go. And we do that for 3 minutes. Now, for those that maybe are postpartum, a little bit more engaged, but we're not ready for planks, there's a challenging one that we do in what we call tabletop or all fours that involves not only the isometric contraction, but the concentric, which is engaging the abdominal muscles. Isometric is where you hold it for the count of 10. Here's the hardest part, and this is where you get the most strengthening, is with eccentric control. And that's letting the contraction go down. And I do it on a count of 10.
Okay.
Yes, yes.
Is that kind of like if you were doing a pull-up? You pull yourself up and you slowly let yourself back down. Is that eccentric?
That is eccentric control.
Or say you were doing a bench press. You press it up and just slowly bring it down.
Eccentric control. And
you
that's
get more strength from that than you do the
more
actual
strength gains, yes.
concentric
yes.
movement. So that is really interesting. So when you're laying on your back and you're doing these tightening, you try to bring the lumbar part against the floor.
For the abdominal work, yes, yes.
Okay.
Now, if we're solely exercising the pelvic floor muscles, there's different exercises that we do for that. One of which is it's called a gentle pillow squeeze, but it's far from it. And it has multiple steps to it to engage the pelvic floor. But with pelvic floor strengthening, you have to engage, you're right, the abdominals as well as the back extensors and the diaphragm.
Mm-hmm. You know, I never think about the diaphragm enough. So I think this is amazing podcast for one thing, polypelvis. This is so interesting because it's so real to look at. You know, I don't think most people, including doctors, think about this stuff enough. You know, to cardiologists, the heart's the center of their body. To neurologists, neurosurgeons, the brain. You're saying it's the pelvis.
It is the pelvis.
I love
Everything circles back to the pelvis.
I think you're exactly right. So this is informative. Now, you believe in prevention, I'm sure. So most everybody listening should be doing these exercises to prevent getting incontinent or having chronic pelvic pain. So do you really think that most pregnant women after they give birth should just routinely see a physical therapist like you to prevent the problem? And then wouldn't you rather prevent it than treat it?
100%. Now, our current generations, Generation Z, the millennials, they are proactive. They are asking for pelvic health services, both during pregnancy as well as after pregnancy, postpartum. The importance of learning how to brace your pelvis when you cough, laugh, or sneeze, lift something heavy, anything that increases that intra-abdominal pressure.
So should they tighten up before they do this?
Yes, but specific muscle groups.
Give me an example. How would you? So I'm about to sneeze. What am I going to do?
What we want to do, we want to brace our pelvis. The way that we brace our pelvis, I want you to pretend like I have $100 bill. Okay. Gonna put that $100 bill between your butt cheeks. All right.
Okay.
I want you to squeeze that $100 bill. Okay. At the same time, I want you to contract your abdominal muscles, belly button to spine. I want you to squeeze and raise your pelvic floor. That is pelvic muscle bracing.
Can you do all this sitting down?
Absolutely. It's actually easier sitting down than standing because we have the advantage in sitting of the chair, increasing that perineal, that pressure at the pelvic floor to brace it.
That support that you're getting.
Yes, yes.
Okay. That is really, it's a lot of stuff to think about. How do you simplify it?
How do I simplify it? Tom, I'll have to say the pelvic floor, it is a complex area.
It's hard
most
to
certainly.
simplify.
Yes, it is. It is. But typically, when I see a patient, of course, every patient is unique. And I tailor their treatment plan to the issues that they came for. Interesting enough, sometimes when I get a referral, it's not what the patient is really seeking. So my first question to a patient is, what brings you here today? Not in medical terms, just plain and simple, what brings you here today? And then second, what is your goal? What is your goal for physical therapy? What goal do you want to accomplish? And I see all ages, and I'll never forget this woman, and she was actually 91 years old. She was 91 years old. And she said, Paige, I want to be able to go to church and not worry about having to get up to go to the bathroom or leaking. That was her goal. And believe it or not, we achieved it.
That is incredible. Just think of what you did for that lady. That's phenomenal. So prevention, strengthening. Tell me a little bit in closing. You actually go to these people's houses,
Yes.
don't you? Tell me
Yes.
about that. I think that's so great that you're doing that. You're going to get to so many more people
Yes.
doing it that way.
And this came about particularly because of my postpartum patients. When you have a newborn, that is such an important time in life. And it's also a time where maybe we have more lack of sleep, getting things together with a newborn, the challenges of being a new parent. It's difficult to get your infant. Number one, childcare, if you had to have childcare. Number two, if you're bringing your infant to therapy, the challenges with that. So it stood to reason for me, wouldn't it make more sense if the therapist went to the home, much like home health?
Makes a whole lot of sense to me. You know, they're trying to bring the hospital into the patient's house now, so you don't have to go to the hospital. You're more comfortable. You're more likely to get better than if you're sitting in
More
a
relaxed too.
Yeah, and you have family around. You're not laying there by yourself. You're going to get better quicker. I think there's going to be way more outpatient hospital treatments with IVs and breathing treatments and everything else in the future. So what you're doing is definitely futuristic, and it's so needed and so underappreciated what you do. So I think this has been great. I need to have you back on here again, and maybe even demonstrating some of the exercises that people can do, if you can actually demonstrate that.
Yes.
A lot of it,
Absolutely.
You could be doing those exercises and you couldn't even know it.
You do it fully clothed. You do it fully clothed. So
Yeah.
yes, absolutely.
Well, this has just been a great session. Any parting words of advice? I'm glad you have your company, that you're doing this. You're helping a ton of people. You see mostly women, but men too. Men have the same problems.
As well as children, all ages, all ages.
That is so great what you're doing. So we could talk about this forever. Do you have a particular site we can go to look at? You have your own website yet?
Not yet, but you can email me at activelifept@gmail.com.
We'll put that on the screen.
Yes.
But Page Mayo, you're a wonderful person. You're a great physical therapist. You have a unique perspective on this, and you have a skill that is so incredibly important. I've learned a ton today just by talking to you one-on-one. But
Yes.
Thank you so much for coming.
Thank you for having me.
We're going to have you back. You are a great teacher. You'd be a great professor. I may start calling you professor.
There we go.
You know, you have a good way of explaining things. Thank you, Page Mayo. Go to her site, and we'll see you guys next week.